Assalamualaikum warahmatullahi wabarakatuh. I am the first presenter from Group 1, which will discuss the topic of cord blood banking. Firstly, let me begin by introducing my team members, which consists of 5. The first group member is Nur Izzati, who is responsible to introduce cord blood banking. The procedure involves in collecting the cord blood briefly, and she will conclude at the end of the discussion. Then, Mas Nurul Adila will address the current issue of cord blood banking. Meanwhile, Azharatul Mawab will explain the technology and current status of cord blood banking in Malaysia. The other two members, which are Diana Akila and Alia Naili, will explain the ethical concerns and integrate them from the Islamic perspective. This is the overview of this presentation, which consists of 5 subtopics. Generally, cord blood is the blood left inside your baby's umbilical cord after delivery. The component of cord blood is similar to regular blood and contains red blood cells, white blood cells, platelets, and plasma. Other than that, cord blood is also rich in stem cells. In general, there are 3 main sources of stem cells in humans, which are embryonic stem cells, adult stem cells, and umbilical cord stem cells. So in this case, stem cells in cord blood can be used to treat 4 main types of physical conditions such as cancers, blood disorder, congenital metabolic disorder, and immunodeficiency. Next, cord blood banking can be defined as a facility to store cord blood for potential medical use in the future. There are 2 types of cord blood banking, which are public and private cord blood banking. The procedure of a medical cord blood collection begins with the cord being clamped and cut after the baby is born. Blood is drawn from the clamp cord into a special collection bag. After that, it was sent quickly to the laboratory for the examination and analysis of the blood. Then, the cord blood is stored in a secure container to prevent undesirable problems occur. Lastly, it was stored in a specialized tanks filled with liquid nitrogen at very low temperatures in cord blood banking.
Next, I'll continue with current issue on cord blood banking. Firstly, the need of more research. Cord blood stem cells have the potential to provide treatment for a wider range of diseases beyond hemophitic disease. Recent research shows that cord blood stem cells have developed into nerve or muscle cells, making them useful in tissue repair and neurological diseases. Some cord blood stem cells may possess a pluripotential capacity similar to embryonic stem cells, making their applications virtually limitless. With sufficient research effort, cord blood may become a crucial tool in stem cell therapy. Secondly, lack of funding for public banks. Due to high operational costs, the majority of public banks need external funding. As the demand for cord blood continues to rise with future medical breakthroughs, the pressure to supply a growing market will place many public banks at a breaking point. Lack of expenses for more trained medical professionals to complete cord blood collection and the expansion of more collection sites, coupled with the generous scarcity of funding needed to maintain operations, will continue to place public cord blood banks in a difficult position. Lastly, inadequate in donation collection. It is nearly 70% of cord blood donation are discarded for not meeting processing and storage requirements. In addition, the mother must also meet certain health criteria taking into account exposure to viral infections of hepatitis B or C, AIDS, West Nile, TB, leukemia, and other cancer types. Such circumstances can leave this specimen unable to be donated for public use. Another drawback of public cord blood banking is the exclusion of donation from multiple births. Women who give birth to twins, triplets, and etc. are ineligible for public cord blood donation for fear of mix-up during collection. However, banking cord blood privately allows the family to have more leeway in storing for their use.
Next, we proceed to cord blood banking services that are available in Malaysia, which are Stemlas, Service, cord, and Stemlas. First, cord blood banking services that are available in Malaysia is Stemlas. Stemlas Berhad founded in 2001 was Malaysia's first private cord blood stem cell bank. Stemlas Berhad is a fully licensed stem cell bank by the Malaysian Ministry of Health under the Private Healthcare Facilities and Services PHFS Act 1998. We devote our full service to the collection, transport, processing, and price reservation of umbilical cord blood and cord tissue. Next, Celsius. Celsius Biotech Group is a high-tech biotech enterprise licensed by the Malaysian Ministry of Health to store child cord blood stem cells. Celsius, one of the Malaysia's fastest growing cord blood banking companies, is also a technological pioneer in this constantly changing area. Celsius was the first company in Malaysia to purchase automated stem cell processing equipment. Celsius continues to provide clients with manual processing service. Celsius Biotech Group is the first AABB accredited cord blood bank in Malaysia in 2015 and is licensed by the Malaysian Ministry of Health. As a trusted analytical leader in the domestic cord blood banking industry, Celsius facilities is always well equipped with fully automated cord blood its processing capabilities. A company with strong values and integrity also is committed to providing all of its clients with super service parallel to the highest international standards. Besides that, Cryocort, founded in 2002, is one of the shortest Asia's largest and most comprehensive private stem cell facilities, focusing on long-term human stem cells, tissue cryopreservation, and research. Cryocort is fully licensed stem cells bank by the Malaysian Ministry of Health under the Private Healthcare Facilities and Services Division of Act 1990. The National Pharmaceutical Regulatory Agency, MPRA, a part of the Malaysian Ministry of Health, has accredited the laboratory to current good manufacturing practice, CGMP in compliance with APIC standards. Lastly, Samsung. Samsung International Singapore Berhad is a subsidiary of the Cryocort Holdings Singapore Berhad that specializes in the collection, processing, and storage of cord blood stem cells from newborns.
For the ethical perspective of cord blood banking, there are 4 perspectives, which are autonomy, beneficence, justice, and non-beneficence. First, autonomy. In donating cord blood, a person has the right to choose freely. It shows that human autonomy is recognized and respected. The basis for informed consent rests on the idea that competent people are naturally autonomous and the best guardian of their own welfare. Legally, cord blood belongs to the child, but only maternal consent is usually obtained for collection, and paternal consent is rarely considered. Next is beneficence. The ethical obligation to benefit the patient while exposing him or her to the smallest possible risk is the basic for the use of hematopoietic stem cell from blood of the umbilical cord in the specific diseases. It is appropriate to underline that given the amount of tissue stored, it would be absolutely necessary to use allogenic donor if it were necessary to transplant an adult or if a patient at any age required a second transplant. Moreover, justice is also one of the ethical perspectives. Equality is one of the most important criteria and indicator for evaluating the success of health-related issues. The umbilical cord blood is disrupted and distributed and accessible to social groups or communities equitably without judging the community standard of living. In other words, health justice occur when all members of society can maintain their full health regardless of economic and social status. Lastly, non-beneficent. The moral obligation of medicine to first do not harm. Quality control criteria were followed and no harm was done. Strict controls need to be implemented such as cellular viability, sample volume, acquisition methods, handle and transport. This is because the quality of the transplanted tissue can be guaranteed to not harm the donor and recipient of the blood.
Moving on to the Islamic perspectives on cord blood banking, based on the research by Jordans et al. 2012, Muslim sources are generally silent regarding the status of cord blood because it were used to not be recognized as having any benefit and were discarded as waste. There are also policies related to cord blood and cord blood banking, which are based on the 2003 fatwa issued by the Muslim World League's Islamic Jurisprudential Council. The ruling permits the use of stem cells from the placenta or umbilical cord with the permission of the parents for research and therapy. Besides, the use of it has not raised ethical or legal issues in Muslim culture, and there is no barrier to its collection, storage, donation and transplantation from an Islamic perspective. There is also no restriction on the donation of cord blood to a public blood bank or the storage of cord blood in a private blood bank for personal use. While both are possible, however, it is arguable that cord blood donation to a public bank may be privileged, at least by some Muslim jurists, because it provides a public good interest, which is maslahah, and promotes the health and well-being of all human beings. Next, based on the Fatwa Committee of Majlis Ugama Islam Singapore, which has discussed and decided that blood transplant from one person to another is permissible with some conditions. First, there is a need for a blood transplant. Second, it is assured by a qualified doctor that the blood transplant does not cause harm to the donor and in fact provides a cure and eases the pain and suffering of the patient. And third, the transplant must not involve any form of trading or cost because the blood of a person is sacred, hence trading of any part of it is prohibited. Cord blood donation, therefore, is permissible in Islam as it fulfills the conditions stated by the fatwa. A Muslim can donate his or her blood, as the blood contains cells vital to replace the blood cells in a person who has leukemia, bone marrow failure, or certain rare inherited diseases, for examples. The collection process does not interfere in the birth process and therefore does not endanger both mother and child. Hence, it is permissible. Since the benefit of cord blood donation is prevalent while there is no harm involved, it is therefore allowed in Islam. In fact, it is encouraged as it helps alleviate other people's sufferings and save lives. Hence, it is in line with the Quranic injunction from Surah Al-Ma'idah verse 32, which means whoever saves one life, then it is as if he has saved the whole of humanity.
In conclusion, even though there is ethical concern related to umbilical cord blood banking, but now it is valid for its content of stem cells. This is because cord blood banking is used to store cord blood and anyone such as close family members can benefit from cord blood banking. Furthermore, there are numerous life-threatening diseases have been found from the use of stem cells in cord blood.